on the same page as somebody else, then we're never going to have a partnership with them, you know? So we have to have some level of alignment, because partnership is about having a shared objective or shared vision. And so we have to have some level of alignment. And the whole reason that we're coming together is to create value. So if we can't do those two things, you're in this red area, and do something else. Now that doesn't mean that you can't ever talk to those people. Maybe it just means that you consult with them, but you don't have a full-out partnership. A lot of our partnerships end up in this top category. So people like each other, you know, people are doing good things, and you know, they're getting along fairly well. But the activities that they're doing are probably maybe not as strategic, or is not creating as much value as they could be. And you know, and I think a lot of kind of the typical philanthropy where you know, give $50 to thanks to do a specific event, or and I have to say, AID is pushing me on this, and we're talking about how we can actually test some of this by taking some of their projects and trying to plot this. The other thing is that I'm working with a couple of groups to actually have a scale. And of course, unfortunately, the people in Bangladesh are like trying to do a PhD dissertation, so I don't know if it'll ever come out. But the thing here is, and I'm going to show you an example in a minute from Bangladesh about, you know, whether we're looking at some of the newer business models to be able to reach base of the pyramid. You know, I think what we want to really try to do is, if something ends up in this category, it gives you an opportunity to have a discussion and say, is this the way we always did it? And maybe there's new ways that we could like move it over a little that would actually create more value. Lastly, I just want to talk about this category. So, you know, if you think about, I don't know how familiar you are with the sweatshop issue with Nike, but you know, in 1998, when Nike was having all these issues with sweatshops, they really had to figure out what they wanted to do. And you know, they were losing money, they were losing customers, and they ended up going to the International Youth Foundation, which is a nonprofit in Baltimore, and said, you know, we really need help. And the International Youth Foundation said, okay, we'll work with you. And first of all, a lot of nonprofits would not have worked with Nike during this time period because they were getting so much heat, and they said, we'll work with you, but the thing is, the workers have to be involved. Now this was a time when Nike did not think that they had any responsibility for anything outside of their supply chain. So not only did they not think that they didn't have any responsibility, but now the partner who's working with them says you have to involve them. And so this is a really tricky area. This is like if you're a VP after the oil spill and you're a nonprofit, you know, and you go to a nonprofit. There's some real potential here if you manage this well. Because if you manage it well and your alignment goes up, you go into this category. But if you manage it badly, it could be really problematic. So I just want to end with one case study. This is a project that I've been working in Bangladesh. For those of you who don't know Bangladesh, this is just some basic numbers. You know, very low literacy rate. Most women still deliver at home. A lot of women are anemic. And so this project was extending the supply chain to allow rural women to be able to sell products. And so what happens in most countries is that at the district level, there's a distributor or some kind of wholesaler. And so in this case, it was Bata Shoes, Unilever, and some local Bangladeshi companies. And so they only went this far. But they wanted to get their products down here. And so, to keep it short, I'm not going to go into the whole details, but what happened was they had to create these other levels, like CARE did, to be able to actually get these products down to these women. And what they did was, so each of these people makes a commission on the sales of the product that they make. But the other thing is that what I thought was really brilliant was that Kara said to the companies, don't give us a grant. Give us a commission based on managing this whole outsourced supply chain for you. And so, so this is the first level. This is a local entrepreneur who they call a hub manager. So he actually goes and gets the products from the community distributor. This you can't see very well, but this is a list of each woman, where she's based and how many products she's sold every week, so that they do their inventory, which is now being computerized, but in the beginning it wasn't. These are the women. And then this is the main thing. So in 2010, based on that whole managing the supply chain, Kara received $178,000, which was enough for this project to split off from Kara and become a separate social enterprise in Bangladesh. The people the entrepreneurs get a 5% discount. Most of them are able to double their salary. The service people also got a commission, and then, I know that this doesn't sound very much, but these were women that had no income before and now are making $19 a month. So, lastly, I actually manage on LinkedIn a group that is called NGO Corporate Partnerships. It's free to join. You just send a request. There's over 500 people in it already. I'd love to have more people, and I'd love to have questions. And I think Carol's on next. Or
Jeff.
oh, Jeff. Okay. Sorry.
Right, thank you for having me here this evening. I'm just going to start out with giving you a brief overview between Abbott and AbbVie, since we just split in January. Then I want to give you a few examples of the work that we're doing with the AbbVie Foundation. Some of that was carried over from the Abbott Fund, and then also talk about some variations, what's happening within our corporate giving program, and actually play off of some of the things that Susan was talking about. So this is I hardly ever talk about the company, but because it's so new, I just want you to know what happened. Basically, AbbVie is the pharmaceutical company from the split between Abbott and AbbVie. Abbott continues. Suki's here to represent Abbott and the Abbott Fund, and that's focused on medical devices, diagnostics, and nutritionals. So this just gives you a quick overview of who we are and what we're doing. And we're still talking with each other as former colleagues, but we're going down different paths. So this is give you a snapshot of what we're doing. We're a relatively new foundation, although again we carried some grants over with us. So HIV and AIDS, as Michael mentioned, I helped start the International Giving Program for Abbott Fund back in 2000, and the initial focus was on HIV and AIDS. And we have the Baylor College of Medicine Pediatric AIDS Initiative, which was our first grantee, and they're still our grantee. We've invested more than $25 million in cash and $25 million worth of product donations. So a long-term grantee. AMPATH is based in Kenya, Eldoret, connected with the Moy Hospital. I'll talk more about that in a few minutes. About a 7-year grantee, going on year 8 next year. And Direct Relief oversees our rapid test donation program. We have now donated more than 20 million HIV rapid tests, up to 23 million now. We made that commitment in June of 2002, and we met our goal last April to reach 20 million. I mentioned a little bit about all of this because to your point of making those long-term commitments is critical, and the in and out kind of situations we've learned don't always work that well. We're relatively new in the neglected tropical disease or NTD space. We're working with MAP International in Ivory Coast around Buruli ulcer, and University of Notre Dame with lymphatic filariasis or elephantiasis in Haiti. And in education, we have some grants here. I'm not going to go into the specifics, except that Asian University for Women now represents some 15 different countries, women attending that undergraduate institution in Chittagong, Bangladesh, and we're supporting their science education programs. And then I just wanted to mention, for some of you know, the city of North Chicago is now in receivership, their school system. And so what we've decided to do with a lot of the grants that we've had spread out all over the country, we're going to really consolidate those grants and really zoom in on making a huge commitment to the North Chicago City Schools as well as the community. So a number of wraparound services, so we're very excited about that. And the two new areas for us are hepatitis C and oncology. And just to hark back again to Susan's presentation, when she talked about strategic alliances, there's also something called strategic philanthropy, which was a term coined in the Harvard Business Review back in 1996. And it means that a lot of companies give in the areas where they have core competencies and or products. So it's not surprising that all of these areas that you see listed here, that we either have products or core competencies. And that's the reason we're in those spaces. That doesn't mean we don't give to the Museum of Science and Industry, or the Shedd Aquarium, or the Lyric Opera, some of those other areas that are more civic oriented, but these are, again, more aligned with the areas in which we have competencies. So let me just quickly, I mentioned the Baylor program already. We started out really the Bristol-Myers, we started out in Romania with the first grant, but shortly thereafter, Bristol-Myers Squibb Foundation joined in. John DeMonte, who's a saint and does great work with BMS. And I mention that because we're fierce competitors in the marketplace, but we love each other on the foundation front. And we have not ever signed a formal agreement, to your point, Susan, ever. Never sat down and John and I signing something together, but we have worked very closely together. And so we consider ourselves partners, although, again, it's not a formal arrangement. And together we have helped really grow the Baylor program. It started out in Romania with us, and then shortly thereafter in Botswana with BMS. And then quickly we started to together build new clinics, BMS in Lesotho, Swaziland, and Uganda, and we built in Malawi, and then both of us built a new clinic in Tanzania. We started out with 800 patients back in April of 2001 when that Romanian clinic opened. I got a little choked up about this. And now we have 185,000 children and young people that we're working with. And we are now, I will say, in a very positive way, one of the minor donors. So BMS and Abbott now are under 15%, and now they have huge grants from USAID, from the NIH Fogarty Grant Program, from CDC, and a number of other major donors, and that's actually good news. We wanted to broaden their donor base and to continue to do, as they continue to do great work, we're still there with them, but they're not solely dependent on BMS and Abbott. Just incidentally, one quick thing on the Tanzania CO, the clinic, or they call them centers of excellence. We built those clinics, and USAID put up $22.5 million to run them for the next 5 years, and they just re-upped that grant last year. So that's a beautiful partnership when you have, again, that kind of collaboration between USAID and the private sector. And again, we never signed anything. It just happened through the good work of Baylor. This is a program in Kenya, an AMPATH program. We're really focused in on their home-based counseling and testing program, and they're reaching nearly 1 million people now that they've tested, and they have a number of donors in addition to Abbott and now AbbVie, and I should say that Abbott continues to fund them as well. This program has a $75 million grant that they just got from USAID last year for 5 years, and that was re-upped from a grant they had for the first 5 years for $65 million. So here's a program that we entered in where they already had a strong funding base. But we are, in effect, partners with USAID in working to take this program to the next level. What they discovered is that despite their connection with Moi Hospital in Eldoret, Kenya, and there's some 50+ clinics, that they still weren't getting a number of people into care and treatment than needed to, and so they decided to go out the door, outside of the institutions and knock on people's doors. When they initially went to them, they had a very poor reception. People were afraid, why are you here to test for HIV? My neighbors will know what's going on. A lot of paranoia, a lot of pushback. So they regrouped. This is the Indiana University School of Medicine. They have 9 other university partners, and they said, let's rethink this. What do we need to do to get people to welcome us into their homes and agree to be tested for HIV and AIDS? So they said, we need to really package this in a way where people will be more accepting. So now they offer not only an HIV test, but a TB test, a diabetes test, a blood pressure test. They hand out bed nets for malaria. They hand out deworming medication, and they do a nutrition assessment. If you need food, you can get it. And they guarantee healthcare because they have this extensive network throughout Western Kenya. They now have a 99% welcoming rate, and over 95% of the people have agreed to be tested for AIDS. This is way off the charts if you look at all the other programs. So this approach, working with USAID and working with other partners, this has really taken off in a big way. But now what's happening, and Abbott is very involved with this, they're building on this strong HIV platform, and they're doing work in diabetes and cancer and heart disease with groups like Abbott, Novartis, Pfizer, and many other groups. And in the diabetes program, another partnership, no paper signed, Abbott, when I was with them, and Suki was actually the one that initiated this through a field visit she did to AMPATH many years ago, decided to donate our diabetes tests and strips to AMPATH. And then on top of that, Eli Lilly stepped up and they are donating insulin. And so we're doing this together, and we both put cash on the table as well. But what's also developing with that program now, the diabetes program, they're starting to charge a modest amount of fee with a pharmacy revolving fund in this diabetes area to begin with, and they're starting to generate income. So that means they never have stockouts, they never have any issues with product flow and product availability. So this all started out with a fairly relatively small grant on the HCV side, and now expanding and using that, leveraging our partnership with them to bring in other partners. And of course, having that strong base from USAID, again, I have to acknowledge that has really helped this program grow exponentially. Their goal is to eventually reach all 3 million people. So this is an example of a group that we just did a home-based counseling and testing with my boss and I and the family that was in just outside of El Dorado, and everything turned out well at this visit. And then I just want to quickly touch on, because I want Suki to also talk about in depth a very new and innovative program with Partners in Health in Haiti. But here are some examples of what we're doing that I mentioned before with the foundation, but also, and this goes back to Susan's point again, there's a lot of other partnerships outside of the foundation. And for example, AbbVie is now collaborating with DNDI, Liberal School of Tropical Medicine, University of Pennsylvania, TB Alliance, Medicines for Malaria Venture. And we're not only working, loaning our scientists to work with these folks to come up with new and better, ideally drugs to tackle these diseases, but we're also flinging open our doors and loaning our compounds of our compound libraries. And so are a number of other companies now working with the Gates Foundation. We're part of the Gates Roundtable that's focusing on this particular area. And there's a lot of activity and a lot of enthusiasm. I was just in a meeting in New York last Wednesday, and there's a real sense of movement in this area where there hasn't been for decades. And so we're very excited about these kinds of programs as well. Even though the foundation's not directly involved, we're supporting and encouraging these. And there's other programs that we're working with our university relations folks, our corporate folks that are doing a lot of corporate giving. And Suki will talk more about that. There's a mix of foundation and corporate dollars in the Haiti Initiative. So there's many different ways that we look at partnerships. Some have worked very well. Over the years, you're getting a sense of some that have worked, some that are still a work in progress, and some have been a struggle. And some of them that are not listed on the board here today did not work out, and we had to pull back after sometimes a year, but sometimes even after 3 years, even though we thought we might be going longer at the front end. But what is, I think, most critical is to listen when you work to create a program in the first place. Listen to what people think they can do, what they want to do, how they want to work with each other, with us at now AbbVie Foundation or prior to Abbott Fund, and really have patience at the front end, especially with new and innovative programs, and give them a chance to grow. If we had, for a minute, told Baylor that, you know, we will only work with you unless you have to guarantee that you're going to reach 185,000 people in 10 years at the front end, it would never have happened. We had to let that program really blossom, and we had to encourage it and nurture it along the way, along with BMS and others. Similarly with AMPATH and other programs we're working with. So listening, being patient, and being focused on what we want to do, I think has paid off in spades over and over again. But we've had many challenges as well, and I look forward to talking about both the good, the bad, and I guess I'd add, and the ugly.
Yeah.
So all three of those things during the Q&A session. Thank you very much. I should just quickly add, this just hot off the press. I was visiting at the IU School of Medicine yesterday, and they just printed these AMPATH things out yesterday. They're just available. So if you want more information about AMPATH or any of these programs, just Michael Diamond can connect you with me or come see me afterwards.
It's always very difficult to follow Jeff. Say, I've worked with him now for, I don't know how many years.
Not long ago.
4 or 5 years, and it's it's just like very motivational. It just has so many great things to say, and creates so many ideas in my mind. So, so thank you to everybody, and thank you, Michael, for inviting this today. I was gonna really enjoyed your talk. Kind of gave me 2 things top of mind. The first thing is that now I guess I know how to properly define some of our partnerships, and then the second is that we are significantly understaffed.
Yes.
With all these things, I'm like, oh my goodness, I don't know how we do all the things that we're supposed to be doing. So, all right. So I'll go ahead and get started. So I'll represent the other half that Jeff had talked about, and that's Abbott. And just very briefly, just talking about who we are. And we are now half of what we used to be, but we're a global healthcare, broad-based healthcare company, and that our core competencies are really in the diagnostics, in medical devices, in the established branded pharmaceuticals, and in nutritionals. And then also from our Abbott Fund on the philanthropic side, that's the Philanthropic Foundation of Abbott that was established in 1951. And as everyone else has said before me, we have a broad range of partnerships, and some of them are sort of more on the I guess on the bottom left, which is or on the left-hand side of the chart that Susan showed you, that are really more just engagements, and there's some sort of minimal level of engagements, and then there's ones that that are really more on what we'd say some of the joint programs, and that's where we're really trying to shift a bit more towards is sort of figuring out sort of beyond money, what ways are can we engage to really tackle some of these global problems. How else can we do that? What new models can we take a look at and try to employ to really make a significant change on the needle? And it really is going to depend on what it is you're looking to do. So we do things like we do product donations. So we've been working with disaster relief efforts, and so that that will tend to be sort of a one-time product donations, cash grant, and then there'll be things that'll be more strategic and will include things that that are really sort of these new things that are going to be engaging things that are our expertise and with financial as well. So what I'd like to do tonight is really focus on this great project this program that we've initiated now back in 2010 in Haiti, that really is sort of this new model. It's a new social enterprise model that is really, again, sort of looking to do something different, do something a little bit riskier, do something they haven't done before, and really, again, really trying to do something to make a big difference in Haiti in relationship to pediatric malnutrition. So Haiti, I think most of you are familiar with Haiti, particularly since the earthquake back in 2010. But it's a very small country, about 10 million population. And it suffers from many of the same challenges that other developing countries face in terms of limited clean water, access to clean water, low or high unemployment rates, high levels of malnutrition. And I think one of the things that is startling for me, since this was really the first time I had been to Haiti was at the start of this project, is that it's literally a 1-hour flight from Miami. So I don't know if you know, if any of you here have been to Haiti, but I think that for me is sort of one of the very, very shocking things is that that you take a 1-hour trip, you leave the bright lights and sort of the glitz of Miami, and 1 hour later you've landed and you're setting foot in the poorest country in the Western Hemisphere. So clearly a country where there's great need. So Haiti here is also a country where over 25 years ago the founders of Partners in Health decided, this is a country where we're really going to focus on. And since then, they've become the largest provider outside of the government of healthcare in the country. And what they found over that time is, since then, is that every child coming into their clinics, which now they have 12 clinics and one of which, or 12 facilities, and one of which now is the huge new teaching hospital